All right, so how's it going, guys? So this is Dr. Syed, Specific Chiropractic, preventing constant chiropractic in Manhattan, NYC. So we got a special guest over here, clue us in. What can we do to help you, sir?
How are you? How you doing?
I'm doing good. How you doing?
Good. Probably getting better.
All right. So what can we do to help you, sir?
Shoulder issues. I dislocated my shoulder, so hopefully I'm on the right spot. I guess I am.
Okay, so when did you just dislocate that shoulder?
Saturday, which happened not even a week ago. This Saturday is going to be a week.
Gotcha. So my understanding is that during the consultation, you mentioned you went to the ER and they reduced it.
Yes.
Right, they set it back in?
Yes.
Okay, but this is not your first dislocation, is it?
This is my 5th dislocation.
5th dislocation.
Yes.
All right, that's quite a bit there. Okay, and other than the shoulder, what else is going on?
Lower back issues.
All right, so let's take a closer look, see what's going on. Right?
Absolutely.
So now, going based on this history, right? So we got a recent shoulder dislocation that's been reduced. That means the doctor set it back in place, right? And we're gonna take a look, see what else is going on in there. But it's not his first one. So because it's 5 dislocations, why is it doing that in the first place? Well, we'll touch base on that in a bit, but very briefly, what I'm considering is that, okay, we got some kind of subluxation. That means there's not enough nerve flowing from the brain into the ligaments to hold these bones together. Now, normal, you want to see it should be like this, nice and taut. However, because there's not enough nerve function to it, we got some slack. So all it takes is some kind of blunt force trauma to it, and then boom, okay, it will start moving and start dislocating in that manner. So I'm going to take a closer look on the spine. Where are the potential subluxations in the spine that involve in causing this shoulder to keep knocking out of its place? So now taking a look at his x-rays over here, and also on the spine over here, you can look forward, sir. There's some particular areas I'm looking at. Now with this instrument device over here, it's going to look for that potential inflammatory process. And we can see all this reddening. See all the skin just started to turn a little red. Why? So it's very inflamed, this area. I'm also seeing it's very puffy and swollen over here as well. That helps confirm that yes, there's an abnormal heat reading at this level over here. Keep on scanning. So far everything's clear. Now we have another potential reading. We're going to do several passes. Right there. There's one right there. Now this was chronic. That means it's been there for so long that the nerves start shrinking down a bit due to prolonged compression. Sort of like too much weight on a garden hose. You pinch it off for so long, that garden hose is not going to bounce back to its regular size. And that's why I need to tilt the scope to do a comparative analysis of the nerves above it and below it. And because it's so swollen, see, it's all puffy here. This is not as much, but there's muscle spasms here, so that tells me no. I wouldn't be surprised if there's a problem at this level, and there is. Now I'm going to find out what's going on in the lower cervical areas, because there should be another level, another reading over there, and there is. Right there as well.
So we're checking for any signs of inflammatory process, any edema. See, the left SI joint's not moving at all. This was swelling on the left side. The right side's fine. Checking all the sacral segments. And it's not rotating too well. Tender right there?
Yeah.
Yeah, right there. Mark this one right there.
That one hurts.
Yeah, this is number 4. fourth lumbar's in trouble. I'm going to check biomechanically how's everything moving, which it is, until we get right here. This is jammed. Normal's supposed to move. This isn't. See, this is not moving to a line. I relax this shoulder. See, you feel that right there? Yeah, see that right there? That's stuck. How's this fella right there?
Not so much.
Yeah, but it's not moving to a line either.
Yeah.
See, I can feel it. Yeah, not only that, see, there's all this right here, there's all swelling right here. There's swelling right over here. On this side here, on this side here. It's all swollen, universal right there. A lot of muscle spasms on this right side. Yeah, right there. Okay, now next part is this. I'm gonna check your shoulders. Keep walking. Okay, turn on. So I want to show it to the viewers over here. You know, as you saw him when he was walking, okay, as we should, okay, what do we do as human beings? We're walking and we're swinging our arms. He's swinging this arm. He's not swinging this. This is not engaging. So, yeah, this is the one, you know, we're going to see what's going on with this one. Okay, go ahead. Reach behind over here. Okay, relax. Do the best you can with your right one. I want to see what's going on with that one. Okay, all right, son. So I'm not going to do too much of it because it's still pretty subacute, okay? This right scapula is not moving whatsoever. We can see this one is gliding just fine. This one, it's not moving. It's completely locked up. Now, I'm going to be very gentle over here, okay? So with your left one, see how it glides? Anterior and posterior. It moves front and backwards just fine. Internal and external rotation moves just fine. This one going to be very, very delicate because again, they just set this. So this is going to be super acute. Okay, I'm sorry, subacute. So again, gently move forward and backwards. See, complete mobile is moving just fine. Okay, slight fixation right there. But now, when I test it, AC, okay, AC is somewhat fixated. SC is just moving just fine. Check the scapula. See, that's locked up. Scapula is not moving whatsoever. Okay, so here's the story. Right? That's our shoulder blade, the scapula. Right? Now, there are certain muscles involved that makes your shoulder move and work. Okay? We have muscles from here. Okay? Where the rhomboids over here, those are the traps, and also, but more importantly, we have another important muscle. Okay, lats. Okay, now the lats. Okay, as you notice yourself, what do you have the most trouble? Pulling, going up.
For the moment,
Yes.
going up
Yeah.
and pulling too. Sometimes you want to be careful.
Yeah.
Especially right now.
Yeah, that's a lats.
Yes.
That's definitely a lats. So now, another thing is this. Have you been having a physical therapy right now?
No.
No. Okay. Usually when a physical therapist, what they try to rehabilitate is this region over here. Okay. But here's the thing. The other end of the lats is here. That's why I took a closer look, see what's going on way down here. And it happens to be the most common attachment area is that fourth lumbar vertebrae. And we found a potential subluxation on that one. So if this is knocked out, it can cause this shoulder complex to not function properly. In addition to, we also found, okay, there's potential over here, this one over here, and this one over here. Each of these nerves innervate a certain component of your shoulder complex. That's why I properly tested your shoulder blades in terms of, is it adducting, adducting, internal rotation, external rotation? Is it doing all that as it should? Now, here's the thing. If you have that nerve interference going on here, where normal is supposed to be flowing nice and strong like this, but instead it's decreased like this into here. As you explained before, how do we expect the ligaments to hold this shoulder complex together? It's gonna have a tough time doing so, correct? So it's like this. Normal is supposed to be here, but if you have that subluxation in the way, boom, we got slack. It doesn't take much for a little trauma, boom, it's gonna start dislocating. So that may help explain why you have that increased risk of having all these dislocations, not just one, but 5 times, right? So other component is this also biomechanically helps with the shoulder complex as well, and this one biomechanically shoulder complex. So every single one of these all contributing is like the final straw brought the camel's back, since all of these are not functioning as well as they should. That trauma, bam.
Can I ask you a question?
Go for it.
So my last dislocation was in 2013. So the newest dislocation is 2022. Does that have to do with anything? With all these years not dislocating the shoulder, does it heal itself, or how does it operate?
Your body's trying to heal and function as well as it should. Now, I'm not saying like, oh, we got a massive traffic jam where from 5 lanes down to 0. That would not be the case. If you lost all 5 of those lanes, it's more like, okay, what the hell's going on with the shoulder? I can't move it. Okay, it's completely not functional. That's all 5 lanes gone. This is more like, okay, we shut down 1 highway lane. You got 4 still working. It's just 1 not working. Okay, so yeah, it seems to be functioning just fine, but all it takes is just that final stroke. Broke the camel's back, boom, pops out. All right. So like I said, I'm not saying like this, oh, okay, it's like completely so loose, it's like this completely, and just like wiggling like crazy. No, it's like, it should be here, but we got a little slack going on.
Okay.
Right? But not just like this, it's just like, it's a little more than we like it to be.
Okay.
That's what the story is going to be. All right? So that's what the answer is going to be. Let's take a look at the answer. First things first, okay? I see this big bubble right there, and that second circle segment right over there. So because of the instability of this foundation over here, that's what sets you up for everything else to be unstable too. As we touch base right there, as we explained earlier, the 4th lumbar vertebrae, yes, that's out. Okay? So we probably need to address this one to help alleviate and improve that shoulder complex. Another one is right there at your mid-dorsal, another right here, and another one right over there as well. And then after all this, then we're going to finally check the integrity, see how well this thing is moving itself. Let's rock and roll. Okay, so we're going to bring this back. How's that, sir? Not too bad?
It's all right.
Okay. So we feel all the rhomboids right here. This is all stiff. Okay, very spastic. So now we're going to check this. See, the scapula is moving just fine on the inferior. When we feel this over here, see, I could tilt it and move it this way. It doesn't move here. So we have a superior lateral scapula over here. There you go. I'm going to set this profile first. Oh. Okay, come on up, sir. Okay, walk around. Come back. Okay, go ahead. Test his shoulder. See how you like it.
What do you mean to test it? I didn't want to test it.
Just try to reach behind your back. Anything different in there?
Doesn't feel that stiff.
How much improvement would you say from 0 to 100%?
50.
50. Okay.
60. But I was afraid to do this earlier.
And now?
I feel a little bit stiffness right over here. It's not pain. It's a very low pain, but it's more like a stiff. Especially right now, it's stiff.
Understood.
It feels a little bit different.
Different what?
Now that I sat down.
Uh-huh.
It doesn't feel numb. It feels like a sort of a blood is flowing back. That's what it feels. It does feel it. It took a little bit of time, but it feels like it's not numbness. It just feels like relief. Like I felt that it was tight earlier, but now I feel a little bit relieved. It does feel relieved.
Let it go. Let it go. Oh. Okay, come on up. All right, walk down that hallway. One more loop. All right, sir. Go ahead. Reach behind your head with your right. Yeah, with your right one. How's that now?
A little bit better.
How much better would you say?
10 out of 5. 8. 10 out of 5.
That's a good. I know
8 out of 10.
8 out of 10. Okay.
Yes.
So we improved it from 50-60% to now just 80, right?
Yes.
And another thing we saw from the viewer as well, your gait, okay, you're walking, this is starting to engage, start to move better. All right, let's get to the next level. What you were just saying, sir?
I feel more released right after with the shoulder. I feel like when I walked in, I feel like my shoulder was numb. I had pain last night over here. So now that we did a couple of treatments, I feel more released. Like I feel safe with my shoulder. I can say that. I do feel safe for the moment. I cannot feel 100%, but
all right, let's get to the next one.
There.
So here's another thing I'm also seeing as well. Okay, it's this 6 dorsal. It's tilted so much to the point that the ribs should be symmetrical, but yet this one you can see is higher than the rest of them. So this 6 dorsal, that's the one we're gonna set. And another thing is we also see that it's been here for so long, all right? This is starting to degenerate. So you're supposed to be nice, smooth borders, 90 degrees over here. See, we got a little lisp, a little lipping right here. It should be like this, nice and flush. But no, he's starting to develop these fillers over here. And that's from that biomechanical instability all straight down from his lumbo-pelvic area over there. So in essence, it's whole entire spine, you're starting to go like, twist like this. And right there in the middle of the spine is that 6 dorsal. That's why you start to have degeneration right there. And that's what we're going to address right now. I'm going to move this back. I'm going to show to the viewers once again. How's this feel now?
Lighter.
Lighter, right? Yeah, so you start to move more. Let's get some more nerves working in there. Right there. Right this over here. Relax it up. There you go. Oh. Okay, breathe. Now show the viewers again. How's the shoulder feeling now?
Oh.
What's different about it?
Doesn't feel stiff.
Okay, come on up. Okay, go ahead. Walk down that hallway. How do you like that? So the viewers can see his hands, they're almost symmetrical. You're still not swinging this as much as that compared to your left, but we're getting there. Try to reach behind your head. See how you like that now?
Easier.
Let's show it to the viewers in the back. So, well, how far can you reach over here?
Wow.
Oh, wow, what?
Interesting.
Interesting what?
I don't feel pain.
Turn it out. You don't feel pain.
I don't.
Okay, so what else?
I don't know, I'm surprised. I really don't know. It's interesting. I don't feel weird. Honestly, with the shoulder.
I'm sorry, can you clarify that again?
I don't feel weird with the shoulder.
You don't feel weird about the shoulder?
Yes.
Can you clarify what do you mean by weird? What was weird about it before?
Okay, before it was like, I knew that I dislocated my shoulder. But now I don't feel that. So if I have a memory loss, just hypothetically saying, I would be like I did not dislocate my shoulder because I don't feel weird about it.
Gotcha. Like I said, we're restoring the nerve function. We're removing that nerve interference, allowing these ligaments to start to become a little more taut. All right, they start to tighten up now. That's why I start to feel getting closer and closer to normal.
Mm-hmm.
All right, let's get to the next part. Yeah, the second dorsal's in trouble. So we got 6 cervical. Okay. Oh, this is itching to go. There we go. Oh, there it is. Okay. There we go. Drop the belly. There you go. Just relax the shoulders. There we go. That was a big clunker right there. Okay, now let's check this shoulder. Feel that difference in there? See, now it's actually moving. I don't even need to set the scapula. See, there's nothing for me to set. It's moving. Okay, come on up, sir. Go ahead, walk up and down this hallway. Doing that. Okay. All right. Turn around. Okay. Reach behind. Tell me, what's different about it?
I would never thought that I would be able to do this within not even a week that I dislocated.
Okay. Turn around.
Honestly.
Can you say that again?
What I said is that I would never think that I would be able to do this with not even a week that I dislocated my shoulder. And it's really true. Whoever wants to believe it. Right?
Right. So tell me, what's different about that shoulder now?
It's lighter. It's not stiff. I can move safely. I was afraid I did not want to hurt it. I was not ready to do movements. Still, it was a very short period of time that I dislocated, but it just feels like normal. It feels like normal.
Oh, you're loving it, brother.
Interesting.
That's the beauty of chiropractic. Okay, our job is to remove nerve interference. Okay, yes, pain relief is part of it, but the bigger picture is no. You got to restore the nerve flows into all these tissues. So you were slack like this, and now we're starting to get you a little more taut, to get you closer to over here, right? That's why this shoulder is now starting to feel normal.
It does feel normal.
Yeah. Now I saw you on your gait. You're almost there. You're pretty much 80% of the walking gait of this shoulder compared to your left one. So we still got some more work to do, but we'll keep on working on it. But other thing to keep in mind is because it's still subacute, that means you just injured this thing 5 days ago. It still needs another 2 more weeks to properly heal up. All right? And over that time, I wouldn't be surprised your walking gait, the way you swing your arms, is going to be the same to your left one as well.
Perfect.
All right? So your homework is this. I need you to actually ice way down here. Okay? Not in your neck, not anywhere else, just your low back, because this is your root or your foundation that supplies proper support to your shoulder complex. If the low back goes out, this will go out as well. All right? Okay, sir. You're all set. I'll see you next time.
I'll see you soon.
Oh, you're very welcome.
Thank you very much.
You're welcome.